Arthroscopic triple cross-locking technique for medial meniscus root repair. The patient is in supine position, the knee joint flexed 90 degrees and fixed with the knee holder. Anterolateral and medial portals are established. Diagnostic arthroscopy is performed and decision is made for medial meniscus root repair. The medial collateral ligament needling is done for widening the medial joint space for improved maneuverability. Far medial working portal is created using a simple needle as a guide which allows better access to the posterior horn of the medial meniscus. Utilizing a motorized shaver and ablation electrode, all scar tissue in this area is carefully removed, ensuring a clean repair site. 45 degrees curved hook is introduced through the medial portal and the first pass is made at the level of the posterior horn of medial meniscus. A traction PDA suture is then passed through the meniscus and first orthocore suture loop is introduced to the joint for creating first loop. For this reason, a prop hook can be used or any proper instrument. The hook is again introduced to create a second loop in the posterior horn. Then two sutures are passed through each other's loops, providing increased stability. This cross-locking mechanism mitigates a risk of varied pulling vectors that can lead to the cut-through phenomenon often seen in meniscal repairs. Third suture is passed through the capsule behind the posterior horn, and this suture is also passed through the loops of the other sutures. Then ACL tibial aiming guide is placed on the footprint of medial meniscus root. A pin is introduced and is over-drilled with 4 mm cannulated drill bit. Then PDA suture is passed to the joint. All three sutures are retrieved from the joint using a loop of PDS. Finally, all the sutures are passed through the eyelet of a titanium button and fixed firmly against the cortex of the tibia. The stability of the root is then checked. Thank you for your attention.